Good morning. I'm George Latimer, Westchester County Executive, and welcome to our latest edition of Facebook Live COVID Conversations. This is a series of conversations that we've had across Westchester County with those inside county government and outside of county government and their respective responses to the COVID crisis that is now in its sixth month across the nation and across the world. Our program today regards an interesting, innovative program that's been created by both the New York Presbyterian-Hudson Valley Hospital and the Westchester County Youth Bureau. And the leaders of those two organizations are with us today. Let me welcome Dr. DaMia Harris-Madden, who is head of our County Youth Bureau, and also Stacey Petrower, who's the president of New York Presbyterian-Hudson Valley Hospital. Stacey, DaMia, thanks for being with us today.
Thank you for having us.
I've heard it said that a crisis is a terrible thing to waste. And of course, there's a fair bit of cynicism in that line, but it also indicates that sometimes out of difficult situations comes a creativity that might not have existed otherwise. And looking at the response to the COVID crisis, all of us in our respective responsibilities have had to come up with a variety of different ways to do our business, certain things that we can do, certain things that we can't do. Stacey, you're in charge of a significant medical facility in this county. The service that you provide in the northwestern portion of Westchester County and into Putnam County as part of a larger health system. New York Presbyterian also present in White Plains, present at Lawrence in the Bronxville Yonkers area. But for your particular purposes, you saw an opportunity for some involvement in the healthcare issues and young people. So tell us a little bit about the genesis of your vision on this and how the medical institution would be a critical place for this idea to come together.
Thank you for the opportunity to speak about this, George. This is an enterprise-wide, an NYP enterprise-wide initiative. The Summer Youth Employment Program started because it became very apparent to us that another victim of the pandemic was going to be opportunity for Westchester County youth and all across the areas that we serve who wouldn't have the ability to take summer jobs, get career exposure, look for something new, and even earn an income. And in addition to that, it was very clear that this was also going to impact families and youth of families that just have a different level of income. So that is something that is very near and dear to the heart of our CEO, Steve Corwin. And we wanted to both support the Westchester Youth Bureau in this program, but also then extend it into our hospitals. So all of our hospitals, every single campus has interns for the summer. And these interns are the employees of are the children of our employees.
DaMia, under normal circumstances, young people have difficulty finding summer jobs. And now in a COVID crisis, everybody seems to have trouble finding jobs, those that are in need. Tell me just a little bit about the need that exists out there amongst young people during the summer period of time, and how it becomes a basis for cooperation with New York Presbyterian-Hudson Valley.
Sure. Well, thank you first, George, for allowing us this space to talk about such an important topic. It might seem insignificant at times to some people. However, youth employment is really critical for young people that are particularly of low income status or moderate income households, where basic necessities are really needed, and young people go out to work so that they're able to afford books for college, afford basic things you wouldn't even think of, such as underwear and hygiene products, clothing, etc. So we are so grateful that New York Presbyterian Hospital approached us and was willing to support this effort, particularly during this time. But George, historically, youth employment has been a challenge, not just because of the typical culprit, which is age, but due to skill deficiency, competing interests with adults. And for a very long time, in fact, since the Great Depression, we've had a steep decline in youth employment opportunities. I'd say about 30% of young people are absent from the workforce when they are actually able and interested in working. So during this pandemic, this was even more of a challenge because we had naturally the concerns for safety. And we also wanted to make sure that our young people had opportunities, many of which were cooped up inside for a very long time. And so this initiative really was brought to my attention by NYP. And I have to give Sherry Asher a shout out because she actually connected me to Ellen Bloom. And there was, immediate reaction from me. And I'd like to thank the members of NYP, Stacey, incredibly thankful for this opportunity. Ellen, Andres, and Monica, who worked with my team. And when they said, DaMia, we need a proposal, I turned it around in a few hours, 24 hours or so, to ensure that young people, particularly in our hubs, our major urban hubs, such as Mount Vernon, White Plains, New Rochelle, Peekskill. But then we also thought about those communities like Mount Kisco, Ossining, where there are young people who were, really very interested in working, yet there were no funds to make these opportunities available. And the last thing I just wanted to note was we were at a very unstable time in terms of the traditional norms for youth employment. We typically receive funding from the state, and at that time that we were in discussion, the state had not made a final allocation towards summer youth employment. So this opportunity was timely, and we, under this administration, seized the opportunity.
DaMia, what were some of the job opportunities that came through this program? Can you give us some examples of some of the places where placement occurred?
Sure. We had young people working in the private sector, as well as the public sector. The White Plains Galleria, for example, took on some young people. The youth bureaus throughout Westchester County were amazing at springing into action and actually placing young people within City Hall. Many of the young people worked within, the Board of Education, public libraries. They worked in mayor's offices. They worked in city managers' offices. They also worked in parks and recreation, as lifeguards, camp counselors. One place that comes to mind, of course, is the Boys and Girls Club of Northern Westchester, where the young people were able to serve as camp counselors and helped with social distancing. So young people really had a broad options in terms of where they wanted to work. But the key, George, really was to connect young people where there's high growth industries and opportunities for career paths. So the placements within NYP were incredible because those young people have the opportunity now to see pathways to potential careers.
Now, Stacey, the underwriting of this was really a very generous contribution made by New York Presbyterian. Obviously, the hospital system as an entity is suffering some of the same concerns about financing that all of the rest of us are: private individuals, small businesses, large businesses, governments, not-for-profits, and so forth. Tell me a little bit about the decision inside NYP to move forward on this program, particularly because of the resources that you were going to allocate toward it.
Thank you very much for asking that, George. We are an anchor institution. New York Presbyterian is an anchor institution. Our communities are incredibly important to us, and we're here to serve. That's what we do. And so we're looking into other ways to, be conservative, but not at the expense of our communities, not at the expense of the care that we give. So we have over 150 employees' children across the enterprise in internships. I personally was able to meet with 10 out of the 11 so far of the interns at New York Presbyterian-Hudson Valley Hospital. I have to tell you, what we're going to get out of this is going to be amazing, because this is our future. Our kids are our future, the youth of this county, and our hospitals are going to benefit from the experience that they get. And hopefully, at some point, it will be a pipeline for us and for the youth.
When I think of some of the summer jobs I had a long time ago when I was young, I had a lot of physical labor and sort of, it seemed to me like make work jobs so that I could get what was then minimum wage. But you really seem to have put together a strategy where these young people could gain skills as part of what their internship was.
Absolutely. I spoke with a young man yesterday who has already worked in a few different departments at NYP-Hudson Valley, and he's not locking himself into just one potential career path. He wants to explore them all and make an educated decision at the end of his experience and after he finishes his schooling. So it gives me a lot of hope and a lot of just makes me feel good that we're able to provide this opportunity, and it's going to be mutually beneficial. This is just another step in also trying to address the pandemic of racism and racial bias and people not having opportunities. And that's something that we're very passionate about. We have a health justice department, and we're really working hard to make sure that we provide equity across all opportunities.
DaMia, have you gotten any feedback yet from any of the participants? And I know we're not yet through the summer and the process continues, but this is a very difficult time with everybody under some stress and on the edge. But have you heard back anything, any stories of how things are going, and any particular sense of the success that individuals are experiencing in this program?
Sure. Young people have been able to develop the key ingredient to success in the workplace, and that's the soft skills development. And when we look at the research, we know that soft skills account for about 70% of what employers want to see. And so our young people have gone through training, which allows them not just the work experience itself, but also those soft skills, interpersonal skills, communication skills. Those are the benefits that youth employment bring to our young people. They have shared the appreciation for the opportunity to work, because many opportunities were, taken away, and they were, abruptly removed from school and did not have the social opportunities. Now they do, obviously in a safe and socially distant way, but now they're able to interact within the community. And so that is a benefit in itself when we talk about the social and emotional piece to this. But again, I think just going back to what Stacey mentioned in terms of equity and opportunity, this allowed many young people, particularly from lower income families, the opportunity to actually see what takes place within a hospital, see what takes place in a mayor's office, and it gives them access. And that's something that is invaluable for a young person as they are navigating towards, adulthood and graduation from high school. Youth employment really is one of the key opportunities that we need to provide our young people so that they are better informed about career paths. And they are very vocal about their appreciation to be able to earn money, earn and learn. That is a benefit that extends beyond many other opportunities that they could be doing elsewhere.
I'm sure it'll be very interesting, when the program is over, whatever kind of a debriefing element that you have to this, to hear some of the young people talk about what their experience was like, how they felt it went, and what they gained from it, given the diverse nature of the different jobs that they have. When does their assignment officially end in terms of the program, DaMia?
Yes, their assignment actually ends this week. And so we will administer surveys to our young people. And if I may, George, just shout out the organizations that are involved, because they are also
Please.
boots on the ground receiving daily feedback. We have the Mount Vernon Youth Bureau, the Peekskill Youth Bureau, the White Plains Youth Bureau. We also have the newly formed Ossining Youth Bureau, the Town of Greenburgh Theater D. Young Center, the New Rochelle Youth Bureau, and again, the Boys and Girls Club of Northern Westchester. So they will be able to gain information more anecdotal in terms of what they learned. But from the data perspective, we will be administering a survey for them.
And Stacey, on the ground, obviously through the people that are doing the direct monitoring for those interns that are working within your institution, any feedback about how they're reacting in the world of healthcare? That obviously is a growth portion of the business economy, and people who have struck in careers in that direction have had very successful lives. Any sense of how these young people are reacting to being inside your institution so far?
Yes, and I just want to say that I got into healthcare after doing a summer internship between my sophomore and junior year of college because I loved the environment. So that's some of what I hope for our interns. So as I said, I've met with several of them from our campus, and they're young and they are inspired and they're inspiring. They have no problem wearing masks. They understand the importance. They do it with pride because they know that they're part of something bigger than themselves. And the way that they react to being exposed to potential opportunities when they get to talk with leaders in the hospital and with staff members in the hospital and what brought you to this role. And wow, I can do that too. It's really just a fantastic partnership, and I couldn't be prouder of the team that's with us, and hope we get to keep doing this.
Well, I'm sure the professional level of your managers and working with these young people has really enhanced their experience of it, and has probably whetted their appetite for involvement in your field. I jokingly reminisce that one of my summer jobs in the summer between my high school and my college career beginning was as an assistant to a floor waxer, and I had to carry equipment from the back of his car into the houses for the floors that he was going to wax. He was a wonderful guy to give me the job. It was a miserable job, and it convinced me that I wanted to study hard in college and try to have a better life ahead for myself. So different motivations will reach different people in different ways, and obviously you're touching these young people in a very positive way. Any closing thoughts, Stacey, that you'd like to share?
Well, we're looking toward the future where we understand that this is going to be with us for a while, but we still have amazing programs going on. We're opening a new maternity unit at NYP-Hudson Valley in the fall. This is going to be a wonderful opportunity for our communities to deliver at our hospital. We have a fantastic 5-star, and I say 5-star in the patient experience, not like a hotel. And how we care for our moms and newborns is absolutely spectacular. So this new unit is going to be, we built it as family focused, very big postpartum rooms so that the family can be with mom after delivery. Just we have a great medical staff, a new chief. We are associated with Columbia Doctors, Obstetrics and Gynecology, ranked number 4 in the country. So it's really looking toward the future. It's going to be the place to start your families or expand your families.
And DaMia, let me give you the last word.
Well, I'd like to say I am a consumer of NYP, and my children were born through NYP, so I was very happy to jump aboard. My doctors are there as well, and I would agree with you, Stacey. You have a top-notch institution, and thank you for that. I would like to just say I hope this is the beginning of many future partnerships. The private-public sector partnerships that we have developed through this administration have been incredible. And I'm very proud that our youth bureaus locally, as well as our nonprofits, were able to support this initiative, and our young people had opportunities. Again, access is critical, particularly when we want to level the playing fields for young people to have access to high growth industries and to understand what that looks like. So again, I'm just very grateful and thankful, and hoping that this will continue in the future.
We've been talking with Dr. DaMia Harris-Madden, who is the head of the Westchester County Youth Bureau, and to Stacey Petrower, who is the president of New York Presbyterian-Hudson Valley Hospital. Stacey, DaMia, thank you very much for taking time today. We know you both have very busy schedules, but to spend a few minutes here on Facebook and describe this really terrific program. Thank you both for being with us. And we thank you for watching. We thank you for watching. We're going to continue these Facebook Live conversations. Generally speaking, on a weekly basis, we're hoping to continue to move forward as a county, as part of a state and a larger society in dealing with the COVID crisis. The numbers here in Westchester County have improved dramatically over where they were in the peak period of time, but no one is yet confident that we're through the woods. There's still any number of other concerning situations out there. as we have this conversation, we'll be dealing as the next issue with public education in the fall of this year, both K to 12 and higher education. We'll see how that goes. We've been successful so far, but there's no reason to be arrogant or cocky. We're dealing with a pandemic that is serious and worldwide, and we're a very small part of that process. But as shown by the work of the Youth Bureau and New York Presbyterian-Hudson Valley Hospital, there are still great stories to be told, even in this difficult time of the COVID outbreak. I'm George Latimer, Westchester County Executive. Thanks for watching. We'll see you again soon on the same network connection, and we hope in the meantime you'll be safe. Have a good week.